that's it for me in terms of the housekeeping. And let's move on now to the people that you actually want to hear from. And we are going to start with Dr. Amy McPherson, and she's going to speak to you today about how can we support the mental health of children and youth with spina bifida and hydrocephalus. Insights from research. Dr. McPherson is a senior scientist at in the Bloorview Research Institute at Holland Bloorview Kids Rehabilitation Hospital, and she's associate professor in the Dalla Lana School of Public Health and Rehabilitation Sciences Institute at the University of Toronto. Amy's research focuses upon health and wellness promotion in children with disabilities, with particular focus on children with hydrocephalus and spina bifida. So I will hand it over now and pleased to introduce again Dr. Amy McPherson.
Thanks so much, Eric. I was so keen to get going. I came on early, so thank you for your introduction. Hi, everyone. It's great to be here today. It's been a couple of years since I've been at one of the conferences. Last time I presented, I had a giant black eye before falling over. So at least we're better today than we were 2 years ago. So anyway, it's great to be here, even if it's virtually. And yes, I do miss being in person and seeing you. So, so today, as the title suggests, how can we support the mental health of children and youth with spina bifida and hydrocephalus? And I've highlighted the we because we could be the healthcare professionals, we could be parents, or other caregivers, not knowing exactly who is tuning in today. It's sort of a broad we. And a lot of it, I'll be talking about sort of healthcare professionals, but a lot of it is also applicable for parents and other roles as well in children's lives. So next slide, please. So it's obligatory to start any talk with a definition. So what is mental health? Well, if I asked, all of you what mental health was, I'd probably get, many different definitions. This is the sort of definition that we kind of tend to use. It's more than an absence of mental illness. It's a positive sense of well-being, being able to cope with life stressors and having a productive and meaningful life. And often people also talk about kind of quality of life and like well-being, and they're all sort of used in a fairly interchangeable way in the sort of lay language. Next slide, please. So why is mental health a particularly important issue for kids and children with spina bifida? So it's important to say up front that children and youth with SBH have many strengths and abilities, and I'm sure everyone on this call knows that and has seen that. And the environment that young people with SBH live in can have some limitations around independence and autonomy, and that might be because of the built environment. It might be the family dynamic. Often leisure activities might be harder to access. Schooling and employment are often hard to access, and that can be linked to sort of bowel bladder issues as well as leisure activity. Relationships and romantic relationships. There's been quite a bit of research there in SBH, and many people with SBH are sort of quite worried about having relationships for many different reasons. And so there are, many things sort of in the environment, immediate and built, as well as some of the spina bifida symptoms that may limit kids' lives a little bit, which could lead to, or can lead to, lower quality of life and poorer mental health. So it's sort of trying to acknowledge both sides of the spectrum. And then with any youth, transition to adulthood is an important time to be particularly attending to mental health. I'm going to be talking about some focus groups we did with young adults with SBH throughout today's talk. And this was one which I thought was so descriptive of the issues, that they actually didn't have many mental health issues growing up, but then it was the transition to going to university, the change in living arrangements, that sort of transition then really disrupts the equilibrium that you've been living in. So this sort of status quo, maybe at home with maybe mum and dad doing some things, being able to knowing their environment. And so the transition between childhood to adulthood is a risk area for mental health for any young person. But yeah, it might be just sort of the mental spina bifida and hydrocephalus could have some added kind of risk factors. Okay, next slide, please. So we did ask a group of young adults. So we did a couple of focus groups with 8 young adults with SBH. And we asked them, what does mental health mean to you? And why is it relevant for your lives experiencing SBH? And we thought it was interesting because, one of them was talking about with spina bifida, they call it part of the package. So whilst other people may think it's physical, so maybe kind of, the mobility or bowel bladder, they were sort of talking about there is part of it that is bound up with it that can affect the mental health as well. I mean, for many of the reasons that I just outlined in the previous slide. And so we asked them, well, what is good mental health? And they sort of say, you can actually experience a day. So it's like living in the moment, not constantly worrying about the future, what's going to happen. And then I have to say, I love this. It's mental health means to me, you're not obsessed with something that you can't control, or you're kind of like you experience life through your eyes instead of your mind. And that has to be the single best quote I think I've ever seen around mental health. And this is interesting to me because although I've been a researcher for 25 years in this area, I'm actually currently training as a psychotherapist. And so this idea of sort of all these things, these threads coming together, and this idea of kind of getting out of your head and sort of enjoying the world is something that I work with quite a lot with people who are seeking mental health support. Next slide, please. So I'm jumping around a little bit, sort of, but I wanted to highlight, because of course, COVID, there's been a lot written about COVID, the impact of COVID on children and young people's mental health just generally, as well. And there has been a lot of concern around kids with disabilities, whether, they are really experiencing a lot of sort of downturn in their mental health. And there is evidence either way. Like some people with disabilities have flourished because it's been, everything's been virtual. It means that things are much more accessible and things like that. But, we do know that the COVID has had an impact on people's mental health. And, many of us tuning in today might also recognize that kind of individually. So we asked in a survey that I'm going to talk about in more detail later about how the parents would describe the children's physical and mental health. And we asked pre-COVID and after COVID. So physical health is not sort of, excellent and very good are pretty similar. Good before COVID was more than after COVID. It is different, but it's not sort of dramatic. But if you look at the children's mental health, whilst excellent stayed the same, and that's possibly because those kids are super resilient and have all these kind of resources, like mental health resources or psychological resources. If you could just hit the next button, please. Thanks. We can see that before COVID, over half said their child had very good mental health, and this dropped down to 9% afterwards. And then some of them, and if you look at FAIR, again, after COVID, it was much higher rates. So we do know that COVID has added to this issue in many ways, and we're still trying to work out exactly, what is affected and what the mechanisms are and how we can address them after COVID, whenever that may be. Next slide, please. So having talked to the young adults with SBH, we really, the reason we talked to them, because we were like, what is important to you? What should we be researching? I can sit in my office and dream up, research questions till the cows come home, but that's not much use if they're not of use and interest to the population who they're, about. So through the focus groups, we talked a lot around mental health, and what really came up was about healthcare providers and how they could talk about mental health better with children and youth with spina bifida and hydrocephalus, because the experience of most of the people who joined our focus groups was that it really wasn't discussed, and yet they experienced quite a few mental health sort of issues growing up at different times of their life. So we went away with our research question, and we said, okay, we'll see what we can find. So we did what's called a scoping review. So it's a broad literature review to see what's been published in the literature that could help us answer this question. Next slide, please. So there's going to be a theme in this study, in this talk, because we actually couldn't find any literature on how healthcare providers could best communicate about mental health with youth with spina bifida, or even with disabilities generally in a rehab setting. So there might have been things about communicating with kind of kids with cancer and sort of other things like that, but not necessarily the kind of physical disabilities that we were really interested in around like spina bifida. So we had to reset and think, okay, so what could we do then instead? And so what we did was looking at what available literature was there about mental health communication for just generally young youth and young people, just very broadly in any kind of like clinical setting. And then we were like, well, and then we can sort of afterwards, we can maybe see how this applies to a disability. Next slide, please. So what we found, and this is now published by my excellent research coordinator, what we found sort of was 4 key areas that really came out of the literature. So first is for permission to raise the topic. So children often don't want to raise it themselves. They may not know to raise it themselves, or they may just not want to kind of put themselves out there because it can be, you know, vulnerable. So they wanted to be asked, you know, for permission. And then that permission allows the child to have some control over the situation, especially if you sort of say, you know, who do you want in the discussion? You know, do you want mum in the discussion? Do you want parents to go out? So this piece is really about autonomy and really encouraging child autonomy to kind of learn to ask for what they might need and ask questions and have their concerns addressed. And obviously that's not going to happen overnight. It's not like one day, well, you have to be autonomous. But I think it's a really good reminder that as kids are growing up, to sort of be slowly kind of transferring that kind of independence and autonomy to them, especially in medical consultations, so they can ask for what they need. So that was sort of the one area. The second area was around trusting relationships. And, you know, we know that kind of, you know, the best medical outcomes often are when there's a strong kind of relationship, trusting relationship between the healthcare provider and the child and the family. So really kind of creating spaces where kids are encouraged to raise concerns, whether it's about mental health or anything else, but especially mental health, there's a lot of judgment, a lot of stigma around it. And so to sort of have that positive attitude and provide support and not kind of be judging and potentially saying, well, if the family just did X, Y, and Z, then that can really go a long way to have sort of productive and open conversations. And it was interesting when we were talking to the young adults that I mentioned at the start, that a few of them did say, you might have to prod them. They were like, they're not going to give it up quickly. You know, the young people might need a bit of sort of prodding and probing from healthcare professionals, so that and then we combine with that trusting relationship, so they actually do reveal what they're actually thinking about. Because it's hard, right? Anyone who's tried to talk about their mental health to other people, you know, it can be overwhelming and it can be quite frightening sometimes. So those trusting safe spaces are key. Next slide, please. So the third main area is around prioritizing patients' or clients, young people's perspectives. So really asking what's important to them to talk about. Again, like kind of try and set that comfortable situation. So, you know, they're in charge of what they want to talk about. It helps children kind of being able to express what they want to talk about. But I think what's really important is that isn't a bullet point, but what came up is not to assume that the young person and the parent has the same concerns or the same questions. Because I think sometimes as healthcare professionals, we treat them as a unit, you know, and that's family-centered care. And, you know, that's what we've been told to do and all the literature says. But it is important that we don't treat them just as one, and we maybe do some probing with the different members of the family to see if they have different priorities that they want to talk about, so that all of those are kind of out in the open and can be addressed. So the fourth one, which that is about kids finding different ways to engage kids. So some kids may sort of be find it more comfortable to draw, make drawings, make sure there's things out in the open, information resources. In a slightly different project, we're looking at sexuality, and just having leaflets out in the waiting room, or even like a rainbow flag. They were saying, it signals that this is an okay topic to talk about. And I think that's got a lot of overlap with mental health as well, right? Sort of that idea of like making it normal. It's out there. It's okay if you come in. You can talk to me about this, and using then maybe different communication approaches that may be tailored towards children and youth. Next slide, please. So that was the literature review on what we found, but as I said, that was all pretty much on typically developing kids in the research. So then we had to say, well, okay, so is this relevant to A, spina bifida, and B, kind of disabilities more broadly? So we conducted a survey to find out, and we did expand it to parents of children with other physical disabilities, just because the population is quite small, or the community is quite small, just in spina bifida, and we wanted kind of a bit of a broader perspective. So we sent out the findings with a short survey that I'll talk about now, about like, okay, so this is what the literature says on typically developing kids. What applies, what doesn't apply, tell us what you think. So if you can just click on the next slide. So we're saying from that I presented, the 1, 2, 3, 4, like what is the most important thing that you're taking from that? And so it was interesting that, so the parents say, children might be reluctant to acknowledge it, but actually mental health support is really important. And it may not be, okay, we'll get the psychologist to come in and see you. It's about kind of talking about it more generally during appointments, making it a bit more sort of normalized. They agreed that the trusting relationship is absolutely critical, and they agreed, again, alternative forms of communication could be useful. Now, some of the parents who reported on this had kids with cerebral palsy, so there might be more kind of speech and verbal issues there than we sometimes see in spina bifida, so that was particularly important to them. And then the asking permission and giving children autonomy over the discussions they felt was really important, as well as prioritizing the perspectives of children. So there was a lot in there that they liked and they thought was really important and applied to their children in a rehabilitation setting. Next slide, please. So well, what's missing? And what's missing, they thought, was like very specific language to use. What are the words? What words shouldn't be used? And I find this interesting because some of my other work, with many of my different hats on, is around weight management and talking about weight and body image. And there we actually have done sentence starters like use these words, don't use these words. Because there are some words that generally people react badly to. So it's a little bit more clear there. With mental health, it's less clear. But I think that's interesting about like what words do we even use to bring this up and talk about? And often that puts people off saying anything, whether it's about, we found it in sexuality, we found it in weight management, we found it here in mental health, any of those sort of taboo topics, people really worry about the language. There was missing about sort of speech impairment, so that would be something that would be pretty distinct to kids with disabilities, and then how you engage children there. And of course, skilled clinicians do this all the time, but within the sphere of mental health, how could this be done better? And then how to introduce the topics and conversational approaches. And again, so we've created sentence starters for other topics that people find difficult just to get going on, right? How do I even open the door and get this discussion going? So for sure, that was not kind of found in the literature at all. Those sort of practical things tend to not be in the literature. And we end up having to kind of use, like kind of frontline evidence and knowledge to kind of draft these things and then send them around and get them created by kind of consensus rather than actually finding it in the literature. Next slide, please. And the last thing we said was, what advice then would you give healthcare professionals around talking about mental health and supporting kids' mental health with SVH? And I think these are all important, and we probably all know them, but it's important to try and keep them in our minds. So it's just as important to discuss mental health as physical health. So yes, you need to talk about bowel bladder and walking, or mobility aids, and all of the many other things that spina bifida has a sort of involvement, but also it's just as important to talk about mental health, parents were saying. There's the create safe spaces, having a relaxed environment, children feel confident to talk, say maybe there are posters up, maybe there are postcards out, and also to make children and youth feel less alone. I think anyone who's experienced mental health issues often feels very, very alone in them. And so really that messaging that mental health is just the same as physical health and is equally as important. Parents were sort of really keen on trying to communicate that message. Have it as part of the conversation, just in every clinic visit. I've actually noticed, on a side note, I've been to the dentist a couple of times, and every time he's like, "How are you? How's your health? How's your mental health?" And he actually asks me directly, which I thought was really interesting. So really kind of building that in as part of the clinic, and then sort of helping parents as well, so that parents and healthcare providers can be working together to help support the children and youth with SBH. Next slide, please. This is my last one. So take-home messages, whoever you are out there. So whether you're healthcare professionals, but also parents. Now, I think a lot of the guidance for healthcare providers also applies to other kind of adult members in children's lives. So about normalizing conversations about mental health. Actually, again, on a side, watch our language. There's been a lot of attention brought to things like saying, "Oh, wow, that's crazy. Oh my God, that's mental," or all these things. And we're using that language very, very easily without thinking about it, but it actually is, is obviously quite derogatory towards sort of the mental health. So I'm trying to replace them in my vocabulary, because I have seen that's crazy to everyone. So now everything is bananas, but I've got to come up with a better word. Creating safe spaces for children to raise concerns, and that can be at home or in the clinic. So the idea that whatever children raise, it's not judged, that all feelings are fine, that you can talk about anything. Just a note to be particularly kind of looking at mental health in times of transition. And we know often young adults, once they age out of school and the pediatric clinic, if they're not able to get employment, then that's a period that is very high risk for mental health issues to emerge if they haven't already. Adapting your style to children's abilities and type of communication, and then their take home message from the young people right at the start of this talk was, yes, it may feel awkward about mental health, but too bad, it's worse just not talking about it. So we have to try and steel ourselves and prepare ourselves to talk about it and make it a normal conversation, maybe for us as well as children and young people. Next slide, I think, is my thank you slide. So thank you so much. Quick plug, if anyone's interested to read the findings from our review, and also if they want to complete the survey to tell us what they think of the findings, it's actually still open. If you could just put to the next slide, please. So I know Shauna has sent it out in the past, but if anyone's interested, please either put a note in the Q&A or ask Shauna, and we can also send it out again, because I'd love more of the spina bifida community to be able to comment and have a say in how we use these findings. So thank you so much.